So specifically, which examples indicate that there is fleeting minute or 2-minute transmission rather than just regular stranger-to-stranger transmission, which has been a feature of the outbreak since it began?
And this goes back to, I mean, it's a good question, and there's a fifth site in Reservoir, but with 2 cases. This is a good example. This is where the contact tracing interviews are so important. This is where the in-depth discussions we're having with all of these positive cases, recognising we've now got a number of people involved in this. We're having extensive conversations. We're asking about their movements, the timing of their movements. Where there's QR code data, we use it. That's why getting more QR code data is so important. We use mobile phone data. We use whatever other records we possibly can to try and establish what they were doing. In these cases, and the reason we call them out is that the individuals concerned, the people who are positive, are not saying, oh yeah, I went to the Telstra shop and I had a 20-minute chat with a sales agent, I did X, Y, and Z. That's not what they're saying. What they're saying is, I went to JMD Grocers, I did X, Y, and Z, I didn't have interaction with anybody else. And the 2 parts of that puzzle is what's telling us that a very casual contact has emerged. So that's good contact tracing. This is great data to have. I'm sure we'd be here in a situation that said, if we'd had that a year ago, that would have been great. That's the fidelity we're at now. But it's important that we, as members of the community, that we understand that is an aspect of transmission. So we've always said, and Brett's been really clear on this, households and household meetings and behind closed door meetings are really high risk when you've got positive cases. Workplaces can be really high risk where people are sharing cutlery, food and other bits and pieces. That's really high risk. What we're now seeing, of course, is also there is a potential for transmission at these casual contact sites.
So it's potential. With all due respect, where is the hard evidence that these are fleeting cases, or are we just basing this off what someone has said?
Well, we're basically off the fact that we've got 8 examples of people getting positive coronavirus infections at 5 locations from people that they don't know.
Is that a new thing?
Yeah, that is a new thing.
People are getting COVID from strangers?
No, the people are getting COVID at this scale in these kind of outbreaks. They're not getting it from household contacts. They're not getting it from their partners.
We've seen stranger-to-stranger transmission before. This isn't a new thing.
So if we go back to Holiday Inn, we did not see this intensity proportionally of stranger-to-stranger transmissions. If we go to Black Rock, we didn't see it. If we go back to Shepparton, we didn't see it. If we go back to Kilmore, we didn't see it.
There were a lot more mystery cases back then, to be fair. There was a lot that we didn't know.
Not in the case of Holiday Inn, UK variant. Again, we're the only place to run the UK variant down to ground. Not in the case of Black Rock. So, we can go back to all the chronology, but this is, I think it is really important. It is really important if we're going to be transparent and upfront about how we as Victoria, collectively as a community, deal with these kind of outbreaks. I think it's really important that we explain this is what's going on. Is there hard evidence? Absolutely. We've got 8 people with COVID recovering at the moment.
And that's what they've recounted to you. So do you stand by that this strain, the Kappa variant that's infected these people, is behaving in a different way to what we've seen in previous outbreaks?
Yes, so certainly, and Brett can give a far better clinical explanation for this than I can. But what I can absolutely say in terms of overseeing the contact tracing event, in terms of overseeing the way we put this jigsaw together, in the way that we see the response, the way this virus is behaving, it's very different to the previous cases we've seen here, and certainly here in Victoria. Over the last year, it is operating in a different way. It's not completely unheard of, but it's very different. It's moving more quickly. And I think it's really important if we're going to fight this thing together that we understand that as a community.